So the papers quoted Mr. Ong as saying, a hospital bill today is paid in 3 parts: government subsidy, health insurance claim through MediShield Life, and MediSave. He said it's like a stool with 3 legs and is stable. But he said the SDP has proposed a single-payer system, which means you chop off 2 legs. And that, Mr. Ong, is precisely the point. The stool has 2 legs too many. So basically, a single-payer universal health insurance scheme does not need government subsidies, as everyone is covered by insurance. It is sustainable because it has a large pool of young people who don't need complex medical care. There are co-payments involved, and there will need to be some government payment for those who cannot afford the premiums. But there's a cap on how much every individual will pay. Under Mr. Ong's leadership, government health expenditure has gone from $9 billion to $26 billion, and that's clearly not sustainable in the long term. Now, the SDP plan will indeed result in some job losses for administrators, but there will be more doctors, nurses, and allied health professionals. The value of a single-payer plan is that they are the biggest buyer of services and they can drive prices down. So this is already happening with the Government Purchasing Office, or GPO. So what happens is every year the GPO issues a tender, for example in my field, for the flu vaccine. So the pharma reps tell me that they really want to get this tender, so they bring the price down because they make up in volume what they lose in margin. They get 1 million vials of vaccine sold. It more than makes up for having a high profit with a smaller number. When all drugs and medical procedures come under a single-payer system, prices will invariably drop as companies compete for the government tender. Similarly, with like CHAS, when there's no barrier between public and private, you can deal with other problems, such as where we have too few doctors in the public sector, and the doctors in the private sector, a lot of them have nothing to do, so they do Botox. The premiums will remain affordable, and by our calculations, they'll be less than what Singaporeans currently pay into MediSave right now.